Stress affects everybody. However, different people deal with stress in different ways. Stress has been found to directly increase disease vulnerability. However, it has also been found to indirectly increase disease vulnerability through unhealthy behaviours such as alcohol, drug use, unhealthy diet, and smoking. Smoking can cause cancer, coronary heart disease, lung disease, and many other diseases. Today's presentation will focus on stress and smoking and explain how this can lead to disease vulnerability. The transactional model of stress proposed by Lazarus and Folkman in 1984 explains stress as a transaction that occurs between a person and the environment. Stress occurs when demands, also known as pressures, exceeds our ability to cope. When a stressor occurs, we assess the potential threat of a stressor. We decide whether the situation is threatening, challenging, or irrelevant. This is known as primary appraisal. If no threat is perceived, no stress happens. If we perceive a situation as a threat, we then evaluate the tools we have available to cope with this situation. We can use both internal options such as willpower and external options such as peer support. This is known as secondary appraisal. After we have appraised the event, we then look at the coping strategies available to us. These are problem-based coping and emotion-based coping. Examples of problem-based coping are defining the problem or finding alternative solutions. Examples of emotion-based coping are ignoring the problem or avoiding it, and adopting unhealthy behaviours such as smoking. The level of stresses in a person's environment can affect how often they perceive events as stressful. For example, negative life events such as marital breakup or bereavement obviously lead to higher levels of stress. This in turn can lead to higher levels of smoking. Studies have shown people who smoke significantly more after multiple life stresses have been experienced. People's level of socio-economic status can also affect the amount of stresses that occur. More stresses are obviously available to people in lower socio-economic statuses. They've got more bills to pay, not as much education, and are working non-stop in a stressful job for very little money. This obviously leads to higher levels of stress, and they may have fewer resources to effectively cope, so this will increase their likelihood of unhealthy behaviours such as smoking. People's different personality types can also affect how they perceive stresses. For example, people with neurotic personalities are more likely to appraise an event as stressful. They are also more likely to use emotion-focused coping strategies, such as unhealthy behaviours like smoking. On the other hand, Bandura concluded people with higher levels of self-efficacy have been found to use a higher level of adaptive coping styles. People with higher levels of self-efficacy are also less likely to appraise an event as stressful, therefore are less likely to use unhealthy behaviours to cope, such as smoking. How to deal with stress more effectively and lower your chances of smoking. A lot of the time, problem-focused coping has been found to be the most useful tool for dealing with stress. However, this cannot always be used. For example, when negative life events occur. Emotion-based coping, which has been found to be effective, is social support. Seeking social support has been found to help people cope with stress. One researcher concluded that social support can change how a person appraises an event, causing less stress, therefore less amount of smoking. Increasing a person's hardiness has also been found to lower the levels of stress. In 1979, Cabasa introduced hardiness as a personality style. People high in hardiness tend to deal better with stress. There are three key traits of hardiness: control, commitment, and challenge. A person with a high internal locus of control realizes they are in control of how they react to a stressor. They have also been found to use higher levels of problem-based coping. Commitment involves the belief that no matter how bad things get, it's important to stay involved in whatever the situation is. People high in challenge accept life is by nature stressful. They see the stressful situations as opportunities to grow in wisdom. People high in hardiness tend to deal better with stress. Increasing people's hardiness would result in better stress management, resulting in a lower chance of smoking, therefore resulting in less indirect causes of disease vulnerability. Cognitive behavioural therapy has also been shown to help people deal with stresses in their psychosocial environment and help people use better coping strategies opposed to negative health behaviours such as smoking. Thank you all for watching my presentation.